Guys, this is FARAZ and today I come up with another very high yield topic for your exam. This is acromegaly, and the points which I've written here in this page is only the points that you need to know for the exam. I mean, if you memorize these points, you are definitely done for this topic. Let's talk about this. Well, acromegaly, acro means acral parts and megaly means enlargements. So what you get is enlargement of your acral parts, and this is because of excessive production of the growth hormone that come up from your pituitary gland. So if you get a adenoma of the pituitary, 95% of the cases, once you get a adenoma from the pituitary, then you get this hypersecretion of growth hormone. Another reason why you get them is an ectopic production of growth hormone releasing hormone from certain other tumors, just like pancreatic tumors. Well, as a growth hormone makes your bone grow, your different parts of the body grow. So when they are in hypersecretion, they will definitely grow more than normal as they usually do. So let's start the clinical feature from the face to the toe. In face, they tend to cause a coarse facial appearances. So, and in the mouth, they tend to cause a large tongue. But remember, in the mouth, they do also cause interdental spaces to enlarge, and they tend to cause prognathism, enlargement of your chin bone, and in eye they tend to cause a visual field defect because they tend to compress that visual tract, the tumor, so you do get a visual field defect as well. Coming on the neck, they tend to cause goiter, so hence you get a shortness of breath also. In heart, they tend to enlarge your heart, so they tend to cause cardiomyopathy, and cardiomyopathy is actually one of the major causes of the death in them, so remember that. Another, you come on the hands, they tend to cause spade-like hands, the big hands, and they also cause carpal tunnel syndrome as they compresses the median nerve, so they tend to cause a carpal tunnel. But remember, there's the bilateral carpal tunnel syndrome. In the hands, they do also cause proximal myopathy, so remember that. In the feet, they increase the shoe size, so you will see the heel thickness become increased, so you are unable to really wear the shoes. And they tend to cause an excessive sweating because they again increase the growth of those sweat glands. They tend to cause a sweat gland hypertrophy. Well, they also increase the prolactin level because of the pituitary stalk damage. You get the dopamine level gets suppressed, and the negative feedback on the prolactin has been demolished. So you get the prolactin level high, and hence you will get that galacturia in them. Well, they tend to cause pseudogout as well, as I mentioned in my previous lecture that the pseudogout is caused by VAR5. VAR and W are the Wilson disease, and A for the acromegaly. So they tend to cause pseudogout as well. So the following are the complications that you need to know is hypertension, the diabetes, hypertension because they increase the vessel size, and diabetes because they tend to cause insulin resistance, cardiomyopathy as I mentioned before, and colorectal cancer. Because they tend to cause colorectal cancer, hence you has to do a colorectal screening which beginning from the age 40 to exclude and to be aware of this cancer. Well, let's talk about the investigations. One of the initial investigation that they ask is IGF-1. This factor is actually produced from the liver and the influence of the growth hormone, and because it has the high half-life, so it is important to measure it, and the major functions of the growth hormone is actually performed by this protein. Then we have the oral glucose tolerance test, which I think is the most accurate test in acromegaly, where you tend to give a glucose and then you see whether the growth hormone is suppressed or not, because the hyperglycemia normally suppresses the growth hormone. So if it is not suppressed this time, it means that this means that there is a pituitary adenoma or ectopic production that tend to increase the growth hormone secretion. If that is abnormal, the next step is to do the pituitary MRI, where you will find that macroadenoma. Well, what about the management? We have got the transsphenoidal surgery. Remember, the surgery is the first line in acromegaly, and like the prolactinoma, here the surgery is the first line where you tend to remove that tumor by performing the transsphenoidal surgery. Medications, the first line is somatostatin analog. Remember, octreotide is the one, because normally that somatostatin is something which tend to block the hormone secretion. So again, the octreotide will work. but that's the first line medical therapy. The dopamine agonist, the bromocriptine and carboplatin, well, they used to be the first line, but they used to be used in the past, but not anymore. Another is the growth hormone receptor antagonist in the pegvesomant, which was also used, but again, I think they are not able to decrease the size of the tumor. So the surgery you have to remember when you're talking about the management of the acromegaly. Here are the pictures that you can see. Look at the man with a large face. Look at the man with a enlarged chin. Look at the man with enlarged nose. Look at the man with enlarged ears. And look at the man with an spade-like hands, like huge hands, the big hands. And here you can see the chin is large, the nose is large. These are the orbital ridges. And in the teeth, you will see the interdental space has been increased. And look at the heel size become increased. So you can't even wear the shoes. Again, the same thing. Well, you can see the coarse face with enlarged face, the spade-like hands, and carpal tunnel syndrome. So you all get that. Thank you, guys. Please subscribe my channel, and I will upload a few other topics as well. So keep in touch with my YouTube channel. Thank you very much for watching.